I lived with addiction as a doctor, and I felt that asking for help was absolutely out of the question. I felt horribly trapped. I was afraid. I was afraid if I asked for help, my secret would be out, my reputation would be lost, I would probably be referred to regulatory authorities and I would lose my license to practice medicine. I would lose everything that was dear to me. Hi, I'm Dr. I. Michael Kaufmann, author of Drugs, Lies, and Docs, a doctor's memoir of addiction, recovery, and more. I'm a former family doctor and an addiction medicine doctor, and after that I was the founding medical director of the Physician Health Program of the Ontario Medical Association. And that's a service designed to help doctors who themselves have drug and alcohol and other problems and who need support. But one day, in a way that I never saw coming, a colleague met me in the parking lot behind my hospital and he said, "Mike, this is the day. We care about you, we know what's going on, we need you to get help." And he gave me a slip of paper with a phone number on it and he said, "Call this number and call it today. And I'm going to be checking to make sure you do. And you will get help when you phone this number." And that's exactly what I did. I phoned that number because I was so scared of what would happen if I didn't, now that the jig was up. And that was the beginning of everything good that's flowed from this nasty disease we called addiction, which in my life has turned out so very well. And I really want people to understand that living a life of recovery is a joyous state of affairs. If you have a chronic condition, you want to have this one because it is just a beautiful way to live, for which I am very grateful. Telling my stories hasn't been easy. Writing my stories has been even harder. But I've done it for a few reasons. I've done it for my own self, I've done it for others. In writing my stories, I'm writing a better future not only for myself, but for other folks who will read it. And one of the main reasons, like many who chose medicine as a career, I did that to help people. And I had a good opportunity to do that as a family doctor, and then later helping doctors who needed support, because I knew they would be helping their patients. But in the end, I feel that my lived experience of addiction and recovery has been my particular gift and my particular opportunity to go on and be of help to others. But beyond that, telling the stories and writing the stories, it gives me the opportunity to be of help to others today, tomorrow, and for years to come.